after immunization with the COVID-19 vaccines from AstraZeneca, a highly rare new form of adverse event called thrombosis with thrombocytopenia syndrome, TTS, has been observed. TTS is an uncommon, new, and distinct condition. It occurs when a person's platelet count is low, thrombocytopenia, and they have blood clots, thrombosis. The formation of a blood clot prevents blood from flowing normally through the body. The body also needs adequate platelets in order to aid in the clotting or clumping of blood, preventing excessive bleeding. For example, if you cut yourself, and low platelets can lead to bleeding problems. TTS symptoms have been reported in Australia to occur between 4 and 42 days, most typically 4 to 30 days, following vaccination with the AstraZeneca vaccine. TTS appears to be more prevalent in those under the age of 60. Blood clots can form in various regions of the body, including the brain, cerebral venous sinus thrombosis, or CVST, and the belly, idiopathic splanchnic vein thrombosis. TTS is still being studied by scientists. One idea is that the AstraZeneca vaccine may develop antibodies that react with platelets, causing them to clump together in rare circumstances. Antibodies are proteins produced by your immune system to combat foreign invaders. Blood clots can form as a result of this, preventing platelets and blood from circulating throughout the body. It's worth noting that although a connection has been formed to AstraZeneca vaccine, TTS has not been proven to have been linked to the AstraZeneca vaccination. Blood clots are common, and not all forms of blood clots that develop after vaccination can be traced back to the vaccine. But how do you know that you have TTS? Symptoms of TTS include headache that persists for more than 48 hours after vaccination, or appears later than 48 hours after vaccination, which may be relieved by simple painkillers initially, but then persists. It may worsen when you're lying down. It may also be accompanied by nausea and vomiting. Other symptoms are having a blurred vision, difficulty in speaking, difficulty in breathing, drowsiness, seizures or confusion, chest pain, swelling in your leg, persistent abdominal or stomach pain, and tiny blood spots under the skin, away from the site of injection. Fever, painful muscles, weariness, and headache are all common and expected adverse effects of the COVID-19 vaccine. These usually begin 24 hours after vaccination and last 1 to 2 days. Unless the adverse effects are severe or chronic, you shouldn't be concerned. TTS patients are extremely ill and should be admitted to a hospital where they can be treated adequately. Patients will be directed to an emergency department if a clot in the brain is detected, which is known as cerebral venous sinus thrombosis, CVST. A medical specialist will look after them. The risk of TTS with the Vaxzevria and Covishield vaccinations, which are all AstraZeneca vaccines, appears to be very minimal, based on the most recent available evidence. According to data from the United Kingdom, there are roughly 4 instances per million adults, 1 case per 250,000, who receive the vaccine, while the rate in the European Union, EU, is expected to be around 1 case per 100,000. Countries assessing the risk of TTS following COVID-19 immunization should do a benefit-risk analysis that considers local epidemiology, including COVID-19 disease incidence and mortality, age ranges targeted for vaccination, and alternative vaccine availability. TTS risk factors are still being researched. TTS rates by age have been studied by several researchers. Global Advisory Committee on Vaccine Safety, GACVS, encourages more research into age-related risk because current evidence suggests that younger persons are at higher risk, but more research is needed. Although more cases have been documented in females, it is crucial to note that more women have been vaccinated, and that some TTS cases have been observed in men. As a result, more research is needed to identify whether there is any sex-related risk. To completely comprehend TTS, GACVS urges additional epidemiological, clinical, and mechanistic studies. As part of the study of thrombosis, governments should urge practitioners to assess platelet counts and conduct suitable radiological imaging studies. Clinicians should also be aware that, while heparin is commonly used to treat blood clots, it can be harmful in TTS, and alternate treatments such as immunoglobulins and non-heparin anticoagulants should be examined. The risk of these rare adverse events may vary depending on where you live. As a result, it's critical to assess probable TTS instances in all countries. All cases of TTS following COVID-19 vaccines should be reviewed, reported, and investigated. Using the Brighton case definition of TTS, countries should examine cases based on the presence of thrombosis with thrombocytopenia and the period to onset following immunization. All nations should conduct safety surveillance on all COVID-19 vaccines and transmit data to their local authorities and the WHO Worldwide Database of Individual Case Safety Reports, according to GACVS. This is critical to bolstering evidence-based vaccine recommendations for these life-saving vaccines. Maintaining trust requires open, transparent, and evidence-based communication about the potential benefits and hazards of COVID-19 vaccinations to beneficiaries and the community.